Did you know that NHS offers screening programs to the patients registered with NHS practices in the UK? And these screening programs are not as well known. So I thought to create this educational content about what is available to you if you are registered as a patient with NHS practice in the UK. My name is Fatima. I'm a UK-based GP and I want to talk about these screening programs today with you. The screening tests are offered to people who are well so that a disease can be picked up early on, so that to prevent the development of cancer or any other disease which can be life-threatening. So let's get started. So the first test that we'll talk about today is something that is offered to everyone who's registered with NHS in the UK. This is called the Bowel Cancer Screening Program. This starts at the age of 50 and continues until you are 74 years old. This happens every 2 years. This is a test done to check the risk of bowel cancer. A testing kit is sent to your home address, so you can send the sample of your poo back to detect the presence of any abnormal cells which could cause suspicion of development of bowel cancer. You will receive this every 2 years, and this is sent to both men and women. Next, we talk about cervical screening test, which is done to detect the suspicion or development of early cervical cancer. This actually looks out for the high-risk HPV virus, and if that comes back positive, then you are sent for further tests to look for abnormal cells. So this screening starts at the age of 25 and it continues until the age of 64, and this is every 5 years on NHS. The breast screening is for women, which starts at the age of 50 and continues until the age of 70, and this is every 3 years. So if you have not been invited for any of these screenings, please do check with your local NHS provider, because you should be receiving all these information and invitation for these tests as per this protocol. Next, we talk about the test which is mainly exclusively for men and is mainly to look out for something called abdominal aortic aneurysm, because if we do not scan men at this age, there is risk of that artery rupturing, which can be really fatal. So it is really important for the men at the age of 65 and above to get that screening done. If you have not been invited for this screening or you have missed it, then after the age of 65, you can request or self-refer yourself for this screening as well. There are a few other health checks and prevention tests done in the NHS, which we will talk about in our future videos. The tests offered to newborns, the tests offered in pregnancy, as well as in certain diseases such as diabetes. All of these things which are available to you. Thanks for watching. I will see you in my future videos. Take care.